Welcome back, viewers. This is Professor K. Anuradha from the Department of Social Work, Sri Padmavati Mahila Vishwavidyalayam, Tirupati, sharing her expertise in the field of working with individuals and families. So let's get on to our lesson titled Working with Individuals in Different Settings. This lesson is about the practice of casework in different settings. As students, learning about practice of casework in different settings is important because it gives you knowledge and insights about the scope for casework in those kind of settings. Social work being an eclectic discipline, it focuses on a holistic and integrated development of individuals. So casework as a method of practice has wide scope in many fields. Practice of casework in health, mental health, correction and school settings will be discussed in this lesson. So this takes us to the objectives of our lesson. On completion of this lesson, you should be able to explain the nature of issues to be dealt with while working with individuals in different settings. You should also be able to understand the method of casework, that is basically the nature of casework practice with individuals in different settings. So let us start with the school setting. Casework in a school setting is one of the specialized areas of practice within the broad field of social work profession. Social workers with their unique skills and knowledge play a key role in furthering the purpose of schools in meeting its academic goals. This is done basically by facilitating home, school and community collaboration. As you all know, throughout the world, schools are the main public institutions for social development. So effective casework in schools rests upon the use of well-defined casework skills and healthy interactions with the school personnel. While social workers address a variety of issues at the school level, in casework context, they work one-to-one with teachers, families and children to address the individual situations and needs of the children. As we have seen in the other lessons, casework in the school setting is also based on philosophical assumptions of human worth and dignity, right for self-determination and social justice. Caseworkers work with young people and their school, assisting them to accomplish their tasks associated with learning, growth and development and realize their intrinsic dignity, capability and potential. In schools, the basic thrust continues to be in the application of casework practice. The basic focus of the caseworker in the school is the parent, the teacher and the child constellation. The caseworker has to relate to and work with the various aspects of the child's situation. The basic skill underlying this task is that assessment. Assessment means which is a systematic way of understanding and communicating with the child's situation is very important in this context. Building on the assessment, which we have discussed thoroughly in the casework process and also during the lesson on assessment tools, the caseworker develops a plan to assess the total constellation, which I repeat again, that is the teacher, parent and the pupil. First, the caseworker assesses the child's situation in consultation with the teachers and jointly required strategies are developed to deal with the child in the school. The child also may be, if necessary, associated with another child to consult so that the child provides the needed support in the helping process. The next step is to consult the parents and make a visit or call them to the school to take their version about an issue. A home visit, as mentioned already, by the caseworker may make the parents feel at ease, and the caseworker thus enters the world of the family. During the home visit, caseworker can make the home assessment, observe the environment and also the family dynamics, and work with the family members as a unit. Behavioral, emotional and relationship issues related to peers, teachers and parents bringing dropouts back to school occupy most of the social worker's time in a school. Trained to practice at both micro, meso and macro levels, social workers do undertake multifarious tasks in the school. While working in the schools, a social worker needs to have a thorough understanding of the education system, the challenges that affect the pupils, especially the pupils' knowledge about school as a system, structure and lines of authority, and the ability to effectively communicate and work with children. The social worker's ability to provide the necessary resources to mitigate their situations that impedes their learning is also one of the important issues of intervention. All this work is done depending upon their ability to work with the educators and other specialists in respect to their boundaries of work. Thus, in casework practice, as social workers' roles become more comprehensive, the social workers in schools continue to be a viable and effective alternatives to address the needs of the children. So that's about casework in school setting. Now let us look at casework in a medical setting. Health settings, mainly hospitals, carry on a variety of functions that are oriented towards the maintenance of life and health problems. While hospitals treat illnesses and disease and attend to human needs such as treatment and provision of basic facilities, patients also do have social and psychological needs. And these needs include personal adjustment, problems, social difficulties related to hospitalization, and also family and financial problems, which are a part of treating process in a hospital. It is in this area of social functioning, coping and adapting that social workers address as they are related to the needs of the whole patients. Thus, casework is a method of social work in a health setting which emerged out of the holistic approach to healthcare. Simply stated, when we say holistic, it refers to treating the whole person, that is the whole patient who is in the hospital, and not just the medical problem. Components such as social, spiritual, psychological and physical are felt to be equally important in the personal overall quality of living of a patient. So, casework in a health setting is associated with amelioration, and amelioration, when I say, I mean amelioration of the conditions that predispose or cause social dysfunction of patients and families in hospitals. So here, caseworker assumes a therapeutic role in the psychosocial treatment of the patients and their families, because they suffer emotional distress when they or a family member becomes ill. So caseworkers provide accurate and timely psychosocial or medical social histories to aid in the problem identification and treatment of the whole patients. Content of casework in a health setting essentially involves assessment of the patient's condition, counseling the patient and the family as and when necessary with regard to their reactions to the illness and disability, and facilitation of a treatment plan. In the current scenario, if we see, social workers are also increasingly entering the field of counseling. Counseling, when I mean, the counseling the terminally ill by helping them to work through the stages at the end of their life. So here in this context, social workers' knowledge of individual and family dynamics helps, and it provides an effective basis for casework practice with terminally ill patients and their families. It is extensively reported in literature that when a patient is dying, there is a great loss of not only financial and economic resources, but also of marital and family interaction resources. Many of these families require both individual and family treatment, and in this context, they find that casework intervention is a great source of help. So social workers make themselves accessible to assist such type of patients and family. However, while working with terminally ill patients, the first dilemma the worker faces is about informing the patient and family about his or her illness, especially when it's like a terminal illness, say for instance cancer, HIV, AIDS. They experience the stress factor because it is caused by the thought of death and the anxiety of the family members after the death of the patient is quite immense. Hence, the tasks of the caseworker include ensuring palliative care to reduce the pain and discomfort. And another thing that the caseworker deals with is facilitating the talk about death and helping them to release their pent-up stress. In other words, to ventilate the stress that they are experiencing. The caseworker also involves in preparing the individual and the family for the future, and also motivating the patient mainly for his future and planning on various unmet tasks. The other casework services or tasks that include in this particular setting are providing opportunity and support to the family to accept the illness, and basically opening lines of communication because they need to talk about the consequences in the long run. For instance, in the case of HIV/AIDS, for example, the caseworker needs to handle the issues that are related to stigma and discrimination faced by the family at various levels. The chronically ill present yet another challenge to the hospital social workers. For these patients, as with the terminally ill patients, there is no cure, and there is usually a requirement for long-term care. So this is quite expensive in context of some chronic illnesses, and it is also emotionally and physically draining on both the person, that is the patient, and the family. For the chronically ill, there is a requirement for extensive task-oriented problem-solving casework intervention, as well as the need for and producing resources, such as helping in housing, mobilizing financial resources, providing employment and vocational guidance and opportunities, depending again on the needs and concerns of the patient and their families. Social workers do play a very important role in the surgical units in a hospital setting, and they present yet another picture. They do have many needs and fears. Although most of them recover and return home, some find that they increasingly face changes in their body image after surgery, and also in terms of their social interaction with others. This change is marked in surgical patients because there's always a feeling that something will go wrong in the surgery, and that a limb or a body part may be removed, thus altering their physical image adversely. Since surgery has potential to create handicapping conditions, patients often they do have self-image related problems which require casework intervention. Amputations, surgical scars, insertion of plastic pins or new body parts, they result in such changes that which create multiple psychological problems, not only for the patients but also for their families, and also significant others in the same fashion. In a similar fashion, The removal of body parts, for instance, say lungs, kidneys, etc., results in patients perceiving that they have been adversely altered in some fashion. Together, these threats present a situation where crisis intervention is highly necessary. Social workers are now also being increasingly employed in transplant and dialysis units, which are some of the well-trained and knowledgeable social workers in the medical care field. The demands in these kind of units require that, for instance, nephrology social workers are professionally committed and highly trained in assisting transplant and dialysis patients. It's also expected that nephrology social workers in casework context provide a broad range of services which encompass both concrete, for instance, information and referral, and also psychosocial, which are therapeutic type of services. Therapy by way of casework would encompass issues such as depression, anxiety, fear of death and dying, family concerns, sexual dysfunction, etc. And an additional therapeutic activity is the support and counseling that social workers as caseworkers provide during a dialysis, or when the patient or the family begins to realize that the problem is indeed chronic, lifelong, etc. Dealing with this emotional fallout requires a highly trained and committed social worker who can function equally well with individuals and families. Now let's see about casework in a correctional setting. Social work as a profession has to play a major role in settings associated with correction. In other words, has been playing a major role in settings associated with correction. Some of such settings include children's home, observation home, special homes, etc. A children's home is a child correctional institution that aims at ultimate welfare of the children who are in need of care and protection under the JJ Act. The observation homes are those which are meant to be temporarily to accommodate juveniles who are below the age of 18 years, who are in conflict with law for a period of 4 months. Special homes, on the other hand, are meant for the social rehabilitation of the juveniles who are in conflict with law as a last resort. In such institutions, a social worker has work associated with Juvenile Justice Board and Child Welfare Committees. The issues that social workers address in these kind of institutions are, especially when they are doing casework, they are related to adjustment of the inmates to the institutional setting in terms of the programs, rules and regulations, families and relationships outside, problems related to release, aftercare, resettlement in the community, and so on. The basic function of the caseworker in such a setting is to help the inmates in the institutional setting in guiding them to function within the limits of the institution in which they are. And they are also guided to make constructive use of the programs and facilities that are provided in the institution. Because separated from an outside world, the inmate is either a child or an adolescent or stepping into adulthood, they find themselves away and thoroughly isolated. These are all issues that have to be borne in mind when we are working in correctional settings. So what does the caseworker do in such a setting? The caseworkers in these settings conduct initial interviews with the new entrants who have been admitted, and they assess the extent of the individual's psychosocial turmoil. And the casework interview is more than fact finding. It is a means to establish effective and meaningful relationship with the inmates. And the caseworker strictly adheres to the core principles and values and fosters a climate of mutual acceptance with the inmates in these kind of institutions. And during the casework sessions, the inmate feels that his entry into the institution and the life institution thereafter are being helped by the caseworker. The social worker, that is the caseworker, interprets the objective reality of the situation to the inmate, about the institutional routine to the inmates. He or she helps them to perceive it without any recourse to prejudice. The social worker can educate, clarify and explain at the individual level the authority of the custodial staff and also their expectations in terms of discipline and hard work. And caseworker in fact has to be a bit persuasive and restrain the inmates not to indulge in any anti-administrative activities, because in doing so the social worker can provide motivation for the inmates to modify their own value system and to incorporate society's ideals and values into their code of conduct. Caseworkers who are in correctional institutions also undertake planning and integration of inmates to live effectively and lawfully outside the institution. So this is in a nutshell about the role of a caseworker in a correctional setting. Caseworkers also have an ample role to play in mental health settings. And when we say mental health, this caters to the services related to psychiatric social work. And when we observe the role of a caseworker, we notice that psychiatric social workers who perform casework are extensively working in the field of adult psychiatry units. They are into de-addiction, in child guidance clinics and also in neurology wards and any other settings which are associated with mental health. Psychiatric social workers, they play an active role in the outpatient and inpatient services. Their casework activities basically focus on the psychosocial study of the patients and their families, formulation of psychosocial diagnosis and providing appropriate social treatment. This takes the form of systematic gathering of information and recording of their case history, making home visits, establishing collateral contacts and also explaining and educating distressed family members depending on the problem, and also family-centered casework services. And in such type of activities, psychiatric social workers make special efforts to involve the significant others in the helping process. Mobilization and utilization of resources in the family and community for the welfare of the patient have also been the guiding principles of psychiatric social workers. Each and every psychosocial situation and problem poses a great challenge to the social workers. In a child guidance clinic, depending on the nature of psychiatric manifestations in the disturbed children and adolescents, the focus is on psychosocial situations while we are working with them as well as their family members. The social workers also focus on marital issues, family pathology, and other interpersonal adjustment difficulties in the family. These are handled at individual level as well as at family level. All the family members admitted to a family psychiatric center are guided to participate in the helping situations so that they can explore the possible solutions to their problems. Family therapeutic programs based on indigenous models for understanding the marriage and family related problems are also being used in a psychiatric setting, that is a mental health setting. Another area is rehabilitation. Rehabilitation also continues to be a core activity of a caseworker. Individual disability assessment, employability, their integration into community and re-socialization are some of the important areas into which case services of psychiatric social workers have been extended. Some of such services also include helping them in aftercare and resettlement of the long-term patients. The potentials for rehabilitation of the patient are also assessed in accordance with the nature of assistance and support extended by the family system. and this also includes relatives, friends, and community. The challenges encountered at each and every stage of vocational and social rehabilitation are studied individually, and appropriate psychosocial services are extended to the patients and their families. Yet another area is patients with neurological illnesses and disabilities. They are also offered casework services. This help is in the form of educating the patients and family members through use of casework and provision of specific rehabilitation services. With focus in particular on chronically disabled patients, family members are counseled and guided with regard to future activities, and also they are informed about the social security services and the resources available for help. Regular home visits, agency contacts, and social and vocational rehabilitative measures are undertaken whenever necessary. Apart from all these settings, social workers are increasingly attending into the field of disaster management and also women and child welfare, labor welfare, and so on. We can say that social worker has a multifaceted role to play in different settings. Social work profession is undergoing a tremendous transformation in the contemporary Indian context, and social workers are playing key role in promoting welfare of human beings and thereby enhancing the status of social work profession, and thus the scope of casework in various settings.